is Jack LaRiviere. I'm an AGA-CMP student at the University of Northern Colorado. Today I'm going to be performing a musculoskeletal and neurological exam that will be integrated together. I'm going to start by kind of moving from the head down to the feet and do it that way. My patient Kristen here is going to be letting me perform all these tests on her. So the first thing that I want to do is inspect at the head for symmetry, any maladies or bony malformations here, color, size, everything looks normal. The next thing that I'm going to do is inspect her shoulders, her scapula, her clavicles, all for the same thing, color, size, symmetry, heat, which might be indicative of bursitis or infection. If she had nodules on her collarbones, that might be they might be rachitic rosaries, which would be indicative of a mineral deficiency. But everything looks symmetrical and normal, so we will move on. The first thing I'm going to do is test the range of motion of Kristen's neck. So what I'll have her do is flex, extend, do lateral flexion, and then rotation. So first I'll have you bring your chin to your chest, and then look all the way backwards. Perfect. And then I'll have you touch your right cheek to your right shoulder, your left cheek to your left shoulder, and then I'll have you move all the way to your left, look all the way to your left, and then look all the way to your right. Perfect. Everything seems to be intact. And I want you to tell me if you're having any pain or discomfort when you do these movements. Okay, great. So the next thing I'm going to do is test for muscle strength and check for the intactness of cranial nerve 11. So I'll have her shrug her shoulders, and then Kristen just had her wisdom teeth out, so I don't want to push on her cheeks, but what I would do another test is have her push her cheeks on either side against my hands and test for her rotational strength that way. So we will move on. The next thing I'm going to do is check out Kristen's shoulders. So we're going to check out abduction, adduction, internal and external rotation. So I'll have Kristen bring her arms out, straight out, and then I will have you abduct your arms across above your head, and then adduct your arms and across below. Perfect. Everything seems to be normal there, and her strength seems to be normal as well. So the next thing that I'll do is we're going to test rotation. So I'm going to have you bend your arms at 90-degree angles, and then we'll have you bring your arm. We'll maybe do one arm at a time. So we'll have you bring it down and that is okay. So we're internally rotating and then bringing that up, external rotation. Perfect. So everything seems to be intact there. We had already looked at the AC joint and the clavicle, which were normal. So the next thing that we'll perform is a Hawkins test. So I can also test for strength when we do this too. The first thing that I'll do is a Hawkins test, and this will be passive motion. So what I'm going to do is I'm going to internally rotate the patient's shoulder, and if she were to experience any pain, then that would be a positive Hawkins test, which would be indicative of a rotator cuff injury, specifically a supraspinatus injury. We can do it on the other side as well. No pain, Kristen. And then I would like you to do the same thing, but with your own strength. Internally rotate. Perfect. That's a 5 out of 5, I would say. And then come back against the force of 9. Perfect. And we'll do the same thing on the other side. Perfect. And then come up. Great. 5 out of 5 strength there. So the next thing we'll do is perform a drop arm test, which is, again, testing for rotator cuff injury. So what we'll do is we'll have Kristen bring her arms all the way above her head, and then slowly bring them down to a 90-degree angle. If either one of her arms is to give out, that would be indicative of a rotator cuff injury, and it would just fall to her side. Okay? You can put them down now. The next thing that we'll do is test deep tendon reflexes in these upper extremities. So first one I'm going to be testing is a biceps tendon reflex. That's testing the C5, C6 nerve root. And what I'll do is I will have Kristen relax her arms, and I may need to move them around to help her relax them. And then I will be putting my finger on her biceps tendon and tapping. Feeling for flexion and looking, and I can feel it, which is a positive and normal finding on the left. We'll do the same thing on the right. So move your arm a little bit, make sure that's relaxed, and then tap again. And I'm feeling flexion, which is a positive finding. Okay, the next thing that we'll be testing is the brachioradialis deep tendon reflex, and this is testing the same C5, C6 nerve root. So I will be tapping on my finger here and looking for kind of a wrist flexion, which was present on the right side, and we'll do the same thing on the left side here. And a positive finding there. The next thing we'll be testing is the triceps deep tendon reflex, which is the C5 or C6, C7 nerve root. So I'm going to support Kristen's arm here at a 90-degree angle and be tapping that triceps tendon, looking for extension of the arm, which I am seeing. That's a positive finding and a normal finding, and we'll try the same on the other side. Positive and normal finding there. So we can move on. The next thing that we'll be testing is range of motion and strength in the elbows, and this will also kind of incorporate the hands as well, because I'm going to be asking her to, and the wrist, because I'm going to be asking her to grab onto my fingers. So I'm going to have you squeeze my fingers as hard as you can, and then pull towards you, and then push towards me. And I would say it's 5 out of 5 strength in the arms, the hands, and the wrists there. The next thing that we'll do is I'll have you bend your elbows all the way in and then extend them all the way out. Perfect. Next, I'll have you stick your arms straight out, supinating them, and then we will have you turn over into pronation. Perfect. Everything seems to be intact there. I'm going to have you bring your elbows out like this. And the first thing we're going to do is visually inspect the elbows. If she had any psoriatic lesions or eczema, it would often show up on the elbows. Everything seems to be fine here. So I'm going to be palpating the lateral and medial epicondyles, the olecranon process, and then looking for any ulnar nerve discomfort here. Are you feeling any discomfort? And the color, size, and temperature of these joints is normal, so we can move on. The next thing that I will do is assess Kristen's hands and wrists. So I'm going to be palpating the carpals and metacarpals and the interphalangeal joints here, looking for any swelling or discomfort, which could be indicative of rheumatoid arthritis and osteoarthritis or an injury. And everything looks normal. So the first thing we're going to do is test the wrist. So I'm going to have you flex your hands downward. Perfect. Flexion of the wrist. And then we'll have you extend your wrist. Then we'll have you do a radial flexion and an ulnar flexion. Perfect. Everything seems to be normal there. The next thing we'll do is assess the hands. So we'll have you make a fist and flex your fingers. Then we'll have you extend your fingers all the way. Now your fingers are in adduction. We'll have you abduct your fingers. Perfect. Everything seems to be normal there. So we will move on. The next thing that we're going to do is test for any carpal tunnel dysfunction or carpal tunnel syndrome. We're going to do 2 tests, Phelan's test and Tinel's test, which are a little different but kind of test for the same thing. So the first one is Phelan's test. For the purposes of this video, we're not going to do a 90-second test, which is what you are supposed to do. But basically, the patient brings their dorsal aspects of their hands together and presses on their wrists. And if any numbness or tingling was felt in the 3rd, 4th, or 5th digits in that 90-second period, that would be a positive finding for Phelan's test and may be indicative of carpal tunnel. The next test that we'll do is Tinel's test. We'll have Kristen relax her her hand here, and I would do this on both sides. And what I'll be doing is tapping on the median nerve in the carpal tunnel, and if she experiences any of the same symptoms, numbness or tingling in digits 3, 4, 5, that would be a positive finding for this test. All right? Any discomfort there? Perfect. And I would do the same in the other hand, but for the purposes of this video, we'll move on. And I'm just adjusting a camera angle here. Excuse my fooling with the computer. Now we'll test rapid alternating movement. So what we'll have Kristen do is we're testing cerebellar function, and we're just going to want her to make rapid, repetitive movements to assess for any dysfunction here. So we'll have her tap her index and thumb together, and then I'll have you alternate through your fingers. Perfect. Great. The next thing we'll do is we'll have you take the dorsal aspect of your hand, tap it on the thigh, and then alternate with the palmar aspect. Great. You can stop. Everything seems to be intact there. The next thing that we'll do is a point-to-point localization. So I'm going to have Kristen, we'll first do a finger to nose, or we'll do the point-to-point first. So first, we're going to have you touch my finger, and same on the other side. Now I want you to close your eyes and do the same thing. Pretty close. That would be a normal finding here. Next, we'll do finger to nose. So I want you to follow my movements here. Perfect. Now close your eyes and do the same thing. Beautiful. Everything seems to be intact there. The next thing I'm going to do, I'm going to test Kristen's sense of proprioception. So I'm going to be grabbing her distal interphalangeal joint of her index finger. I'm going to be moving it and asking her to tell me what direction it's moving in. So,
yeah.
And her eyes are closed right now.
Up, left, right.
Perfect. We can move on. The next thing that we're going to do is test stereognosis. So what I'm going to do is have Kristen close her eyes, and then I'm going to pick up an object. I'll show you what the object is. And then we're going to have Kristen tell us what this object is when I put it in her hand.
Safety pin.
That is correct. Safety pin was the answer. Okay, the next thing that we're going to do is test for graphesthesia, or test graphesthesia. So what I'm going to do is I'm going to draw an imaginary number in the palm of Kristen's hand, and I'm going to have her tell me what it is. So,
8.
Perfect. She was correct with that. So graphesthesia test was normal. But the next thing that we're going to do is a 2-point discrimination. So what we'll do is I will put the butts of these safety pins together on Kristen's fingers, and I'm going to want her to tell me how many points are touching at once. So
2. 1.
And then we'll move up the arm here.
1.
And that's a normal finding. I was using 2 points, but as the hands are capable of discerning those 2 points, but as you move up the extremities, oftentimes a person won't be able to discern between multiple points. They'll just feel the one. So that's a normal finding. So next I want you to tell me, Kristen, if you're feeling sharp or dull against your skin, okay?
Dull. Sharp.
And I use the end of the safety pin here. And I could also assess pain, I should, but for the purposes of this video, I'm not going to stick Kristen with this safety pin, okay? The next thing that we'll do is test vibration. And so what I want Kristen to do is I'm going to use this tuning fork. I'm going to put it on one of her distal and phalangeal joints after I've struck it. And then I want her to tell me when the vibration stops. And this, we're looking for, in this 2-point discrimination, and this, we're looking for any neuropathy, which could be indicative of a disease process like diabetes. So Go ahead and close your eyes, Kristen, and stick one of your hands out for me. And I want you to tell me when the vibration on your hand stops. Perfect. So her senses seem to be intact there. So the next thing we'll do is we'll have Kristen get up, and we're going to be assessing a number of things while she's up. Excuse my camera angle adjustment here. So, basically, the first thing that we're going to be testing is gait. So I'll just have Kristen walk back and forth, and we'll be assessing for any abnormal gait, which would be indicative of cerebellar dysfunctioning or any joint pain or joint malfunctioning, back malfunctioning. A number of things could be happening. Knees, ankles. That would just lead to further investigation. Everything seems normal though. So the next thing that we're going to do is a heel and toe walk. So what we'll have Kristen do is walk forward on her heels and then walk back only using her toes and test for cerebellar function that way. Everything seems to be intact there. Perfect. Next thing we'll do is the heel to toe walk. Everybody's seen this on cops, I'm sure, with the DUI stuff. But what we'll be doing is having Kristen put her heel to her toe as she walks and continue walking that way while keeping her balance. Perfect. Good enough for me. Everything looks to be intact. The next thing that we'll do, excuse me, is assess Romberg's test, and we'll also assess her pronator drift. So Romberg's is again another cerebellar functioning test. What we'll have Kristen do is look straight ahead at the wall with her arms at her side, and I'll be looking for any excessive swaying in any direction, which I'm not seeing, which is a negative normal finding. The next thing we'll do is have her close her eyes, and we'll look for the same thing. Everything seems to be normal there. The next thing we'll do is assess for pronator drift. So we'll have Kristen stick her arms out in front of her, turn her palms upward in a supinating position, close her eyes, and then have her keep her arms in this position. If any arm were to deviate, that would indicate that there was some nervous dysfunction happening or cerebellar dysfunction. Okay, you can put those down, Kristen. Okay, so the next series of things, we're going to kind of be, bless you, we're going to be kind of jumping around a little bit, but this is just for the purpose of not having Kristen get up and sit down and lie down. We're going to be assessing a few things while she's standing and then have her lie down for the remainder of the examination. So the first thing I'll do is inspect Kristen's back. So I'll have you turn your back towards the camera, Kristen. So I'm looking for symmetry, position, alignment of the back. There's a proper kyphosis in the lower back and the neck, proper lordosis in the lower back and the neck, and then a proper kyphosis in the thoracic back. Her posture is good. Head is in a normal position. The next thing we'll be doing is testing range of motion. So we'll have Kristen bend forward to assess for flexion. And then I'll get behind Kristen, and she can extend her back backwards. Perfect. Next, I'll have you act like you're going to touch your ankle, and we're going to assess lateral flexion. Same on the other side. Perfect. And then we'll test rotation. So using only your shoulders, look backwards to your left. And how about to your right? Great. These are all normal findings. I'm palpating the vertebra. Everything seems to be aligned well. There's no swelling or deformity. The color is normal. The scapula are in the right position. They're symmetrical, as is the back. Next, I'm going to be palpating the posterior iliac crest. They seem to be at the same level. The anterior superior iliac crest seems to be at the same level. It's symmetrical. I'll be assessing the greater trochanter of the hips. There are no bony malformations there. And then I will also be just inspecting for color and size as well, which all look normal. So the next thing that we will do is, excuse me, we will assess the range of motion of the hip. So this is best done, it's a little bit easier done while Kristen is standing up, and then we will test her strength as well. So Kristen, we'll first test abduction of the hip. So what I'm going to have you do, Kristen, is use this table, and I'm going to have you bring your leg out, and then we'll do the same on the other side. Okay? Perfect. And then, perfect. Go for it. Awesome. Then we'll test adduction of the hip, so I'm going to have you cross your leg over the other, and then the same on the other side. And actually, I should be feeling for strength while I'm doing this. So would you do the same thing again? Okay, that's a 5 out of 5. Perfect. And how about abduction, bringing it away? Normal and normal. Great. Next, we'll assess hip flexion and extension. So would you bring your, and I'm going to support you, bring your knee up on either leg, and I'll assess how strong you are while you do it. Perfect, that's a 5 out of 5. 5 out of 5. And next, I'll have you bring your leg backwards to assess extension, and I'm going to hold you up here. 5 out of 5 there. 5 out of 5 there. Perfect. And we'll test internal and external rotation when Kristen is lying down. So the next thing that we'll do is have Kristen sit down on the table. Oh, I'm sorry, Kristen, would you stand back up, and we're going to do Trendelenburg's test. So this is assessing for joint dysfunction of the hip. So we've actually already had her do this, but she will be flexing her knee upwards, and if she were to deviate midline off of this axis, that would be indicative that she was having a hip problem and there was pain flexing her hip. So would you flex your hip upwards? And she looks midline. Would you do the same with the other? Okay, so that's a negative finding for Trendelenburg's test, which is normal. So we'll have you sit down now. And I'm going to be assessing the knees first. So I'm going to be palpating her patella, her femur, the distal head, the proximal head of the tibia, the tibial tuberosity, size, color, there's no swelling or pain, heat. So we can move on. Next we'll test the knees range of motion and strength. So we'll have Kristen extend her legs. That's a 5 out of 5 on the right, 5 out of 5 on the left. Next, I'll have you sit a little bit close, perfect, and we'll assess flexion. So bring your perfect, and flexion is 5 out of 5 on both sides here. Next, we'll check out the ankles. We're going to be inspecting the medial and lateral malleoli, the tarsals, the metatarsals, the toes, and the interphalangeal joints there. Everything seems to be normal. There's no heat or swelling. Everything is symmetrical. Next, we'll check range of motion. So I'm going to have you plantar flex your feet like this. Perfect. Now dorsiflex. And then I'm going to have you invert your feet. Perfect. And evert your feet. Beautiful. And next, I'll have you flex your toes and extend your toes. Perfect. So everything seems to be normal there. The next thing that we will do is have Kristen lie down on the table in a supine position, and we will test the internal and external rotation of her hips. So I'm going to bend your knee here, and I'm going to internally rotate, externally rotate. Range of motion seems to be normal there. Internal rotation and external rotation. Perfect. Everything seems to be normal there. Excuse me. So the next thing that we're going to do is we're going to perform a Lachman's test, and then we will be performing a McMurray's test. So the first thing, we'll have you sit up on the table, Kristen, and just a little bit closer to the edge for a Lachman's test. So I'm going to have you hang your knees off, and this is assessing for injury to the anterior cruciate ligament. So what I'm going to be doing is, would you sit a little bit closer to the edge? Thank you. What I'm going to be doing is I'm going to be I'm going to keep my hands on the, behind the patella, kind of on the head of the femur here, and then I'm going to be pulling forward on the tibia with my hands. And if I feel the any sublimation here of the knee, then I would know that the ACL might not be intact. And obviously, I would want to check both knees to check for symmetry here. And I'm not finding anything abnormal. Okay, perfect. The next thing I'm going to do while Kristen's sitting is I'm going to check the deep tendon reflexes of her patella and her Achilles. And then I will continue to perform more tests. So first we're going to check out the patellar tendon. This is checking out the S4 nerve root. So I'm just going to simply tap the patellar tendon here and look for a reflex. Perfect. Those are positive findings. Next I'm going to check out the Achilles tendon, which is the S1 nerve root. And I might need Kristen to loosen up her foot here, and I can help her do it by just moving around. And then I will tap the Achilles tendon, looking for plantar flexion, which I'm seeing. We'll do it on the other side. And those are normal +2 tendon reflexes. The next thing that I'm going to do is we're going to assess the heel-to-shin test for cerebellar functioning. So I'm going to have Kristen take her heel and slide it down the her tibial aspect here on either side. The anterior is perfect. Now on the other side, that indicates that that everything is intact there. The next thing that I'm going to have Kristen do is lie in a prone position on the table, and we're going to perform a McMurray test. So basically this is looking for a meniscus tear, and what I'm going to do is I'm going to bend Kristen's knee here. I'm going to rotate it externally, her foot, and then I'm going to put a valgus pressure on her knee while I'm feeling or palpating her knee. And if I were to feel any cracking or popping, or the patient were to experience any pain, that would be a positive McMurray's test, and it would be indicative of a meniscus tear. We'll do the same thing on the other side with a little external rotation, valgus pressure, and then flexion of the knee here, flexion and extension. Everything seems to be normal there. So we'll have Kristen sit back up. Thank you. And next we'll perform some cognitive function tests. Kristen, I'm really sorry. I need to perform one more test. It's Thompson's test. And that is assessing for Achilles tendon tear. Would you lie supine one more time? Thank you very much. So all I'm going to do for this test is squeeze the gastrocnemius and the soleus muscle and look for plantar flexion of the foot. It is present here, but if it wasn't, that might indicate that there was a tear or rupture of the Achilles tendon, okay? And so we can have Kristen sit back up. Thank you very much for your patience. And then we will perform some cognitive functioning tests. So the first thing we're going to do is test Kristen's memory of recent and past. So Kristen, can you tell me what the year is?
2018.
How about what day of the week it is?
Sunday.
How about the month?
June.
How about the day?
17th.
Yes. Now, the next thing that we'll do is tell Kristen 3 words to remember, and then we'll ask her at the end of this examination what those words were to assess more past memory. So I want you to remember 3 words: apple, table, baseball. Would you please repeat those words, please?
Apple, table, baseball.
Perfect. Remember those words because I'm going to ask you in a minute or two what they were. Okay. So next we're going to assess more cognitive functioning with some simple math. So what is 70 plus 50?
120.
Perfect. How about that number minus 20?
100.
How about that number plus 30?
130.
Okay, that seems to be intact for Kristen. The next thing is assessing the thought process. So if a lion killed a tiger, who would be alive after the fight?
The lion.
That is correct. Another test we can do is say, I'm going to give Kristen a word, older, and I want her to spell it forwards and backwards.
Folder. Folder.
Okay, how about backwards? Could you speak a little bit more loudly, please?
Redlon.
Perfect. That is correct. The next thing that we will ask Kristen is what those 3 words were.
Apple, table, baseball.
Perfect. And during this whole exam, her speech is normal. Her language is normal. She's not using dysarthric or slurred speech, which could be indicative of some cranial nerve injury. That will conclude our skeletal neurological exam. Thanks very much for watching.